I come from a low-income family that has struggled with a lot of addiction problems, and I'm very, very excited to be the first in my family to attend college.
I'm the first in my family to graduate from middle school, high school, and it's the American dream to be able to come to an institution like UCLA.
My goal in public health is to be able to reduce the health disparities that are plaguing the communities in which I've grown up. With my mom specifically, just seeing the effect that diet had had on her diagnosis of renal failure and heart failure had really motivated me towards finding creative methods to changing the Filipino menu and the sedentary lifestyle.
I really want to look at planned teen pregnancy, people who get pregnant on purpose.
My goal is to become a primary care physician working in health shortage areas or underserved communities.
My dream job is to work in community clinics, or at least in that environment, working with the community in the non-private field.
To pay for tuition, I've had to come up with an internet campaign to fundraise.
After graduating, I could have anywhere from $50,000 to $70,000 in debt.
Around $60,000 to $70,000.
I'm looking probably at $180,000 worth of school loan debt. It scares me every day. It's probably one of the first things on my mind when I wake up.
The danger is students look at this kind of debt and it deters them from even applying to these public health programs. I know that this appeal for student support and student scholarships will not help me, but it will help future students who want to study public health, go to graduate school, and then go back into the community.
Me being African American and Latino, I think that I need to use my position and go back into those communities.
These communities need hope, or they desire hope, and if I'm able to represent that in a manner for them, that's what I would like to do.
If I can get adults to listen about how they can manage their stress, about changing their attitudes towards physical activity and reducing our obesity epidemic, then I think it's not just worth it, but it's necessary.
Because I know with the time that I have here, I'm not going to only influence or help just one person or one family, but there's the potential to change lives and change generations in a positive way.
The combination of everyone's efforts, yes, I do think we can make a difference.